taking care of your health is your priority, and how you feel is your own responsibility. Usipoziba ufa, utajenga ukuta. So understanding the why behind the medical advice, connecting the medical dots, connecting the medical dots, the medical dots.
Are you tired of stubborn breakouts popping up right before a big event? Ever wondered why acne seems to strike out of nowhere, especially during puberty? Today on the Medical Dots, we are bringing clarity to medicine, one dot at a time. Let's dive into why acne happens, who's most affected, and how to tackle it safely. Before we jump in, remember that it's your girl Lydia Mpisi, a medical student, not a licensed medical professional. And this episode is for educational purposes only. Always consult a board-certified healthcare provider for your personal medical advice. At the Medical Dots, our mission is to promote health literacy, empowering you to understand the why behind medical advice so you can take charge of your health. Because an informed patient tends to get better outcomes, and we believe in healing through knowledge, one dot at a time. Let's start with why acne typically begins during puberty, why it's most common in teenage boys. During puberty, your body produces androgens, hormones like testosterone. These hormones stimulate your sebaceous glands to crank out the extra sebum, that oily substance on your skin. Combine that with increased keratin due to cell turnover, and you get clogged pores, also known as comedones. This leads to acne vulgaris. And since boys experience a bigger surge in androgens, they often deal with more frequent and severe breakouts. Is there anyone in your life, maybe a little brother, cousin, nephew, who just hit puberty and can't figure out why this breakout suddenly appeared? Drop a comment or send me a message to share the experience. We can learn from each other. What about women who have high androgen levels due to conditions like polycystic ovarian syndrome, also known as PCOS, Cushing syndrome, or precocious puberty? Well, androgens do not discriminate. When levels rise, the same mechanism kicks in. Extra sebum, more clogged pores, and acne. That's why it's important to address any underlying hormonal imbalances if you're noticing persistent breakouts. Now, let's talk treatment. Mild acne treatment usually starts with topical therapies like benzoyl peroxide. It's over the counter and an excellent choice because it's both comedolytic, meaning it breaks down both white and blackheads, and antibacterial. It targets the C. acne bacteria that causes acne. So using benzoyl peroxide can also prevent antibiotic resistance, especially when it's combined with oral or topical antibiotics. Beyond that, you might see retinoids plus benzoyl peroxide plus topical antibiotics, just different combinations depending on your needs. So with severe acne, doctors may prescribe an oral medication called Isotretinoin, commonly known as Accutane. It is powerful, yet it is teratogenic, meaning it can cause serious birth defects like cleft lip and palate and even heart issues. And that's why before starting Isotretinoin, patients must usually have 2 negative pregnancy tests, and they must use primary contraceptives like IUDs or oral contraceptive pills, and secondary contraceptives like condoms. Fun fact, the progestin in oral contraceptive pills reduces the estrogen-driven endometrial hyperplasia, meaning the extra growth in your endometrium, and in turn, this can reduce your risk of developing endometrial cancer and even ovarian cancer. However, there's also a catch. Using oral contraceptives may increase your risk of breast cancer. That is why self-medication is not an option. You must always consult your dermatologist, and in fact, a board-certified dermatologist for any skin conditions, okay? I want to take this time to give a quick shout out to my personal initiative, which is called Creating the Dots. This is a community-based program where I help young people to map out their goals and stay authentic to themselves, intentional in everything they do, and open to continuous growth. Because to connect the dots of your future, you must create them fast. And that includes making informed health decisions, like seeking qualified medical help rather than self-treating. Thank you so much for tuning in today. If you found this helpful, be sure to subscribe to my channel, The Medical Dots, or follow the podcast. Share it with a friend who might need a little help clarifying about their acne situation. And remember, we are healing through knowledge, one dot at a time. Subscribe to my channel, like and share this video with your social networks. Follow me on Instagram and leave a comment on any of my Instagram videos or posts and say that you want a Medical Dots merchandise, and I will get you one of these. It comes in navy blue or black, but I can also send you a special treat. So who's gonna be getting this in this month of January and February? Let me know, because I'm excited to give you guys. Okay, fix the small problems, don't let them grow. With the Medical Dots, let the wisdom flow.